Hey guys, this is Dr. Hub. Now we are looking at the primary health centers. So primary health centers in short is known as the PHC. So the HWC and the PHCs. So the population of 30,000. So it has a population of 30,000 in the plains and about 20,000 in case of the hilly or tribal areas. So hilly or the tribal areas. So in case of the urban HWC PHCs, so here there is a population of 50,000. So what are the specialists? So what are the specialists of the UPHC or the polyclinic? That is in terms of urban. So this includes a population of 2.5 to 3 lakhs. So this 2.5 to 3 lakh. And the PHC, the UPHS, they are further extended. So the PHCs and the UPHC, they are further extended to the 24/7. That is the PHCs and the UPHCs. Now let's look at the bed distribution. So in terms of the bed distribution, there is in HWC PHC, here there is essentially 2 beds and the desirable will be 4 beds. Next we look at the HWC UPHC. HWUPHC, the essential is 2, that is 2 daycare beds, and desirable, what will be the desirable will be 4 daycare beds. Now let's look at 24/7. This is the HWC, the PHC and UPHC. So here the essential will be 6 beds and the desirable, if you see, it is going to be 4 beds. So it is higher in terms of essential. Now let's look at the 12 packages. 12 packages. So they are envisaged. 12 packages are envisaged. It is under the comprehensive primary health services. That is the CPHC. So this includes, there is a care in pregnancy and childbirth, care in the pregnancy and the childbirth. Then there is also the neonatal and infant. There is a neonatal and the infant healthcare services. Next comes the childhood. There is a childhood and the adolescent healthcare services. Next involves the family planning. There is family planning. Then there's also the contraceptive diseases and the national health programs, that is NHPs. Then there is also includes the general outpatient, the general outpatient care, and this will be for the acute simple illness and also the minor ailments. Next there is screening, prevention and control. Screening, prevention as well as control, and this is of prevention, the screening, prevention, control as well as management of the non-communicable diseases, NCDs. Then there is also care. The care is for the common ophthalmic. There is common ophthalmic as well as the ENT problems. There is also the basic oral health, which is done, basic oral health, and there is also in terms of elderly, and there is elderly as well as palliative. There is elderly as well as a palliative healthcare services. Then there is emergency medical services, that is EMS, including the burns and the trauma. Lastly, there is the screening. There is screening and the basic management. The screening and the basic management. These are the mental health ailments. Mental health ailments. Now let's look at the IPHS. IPHS 2022 normal manpower. This is at the PHCs. So the essential manpower for the PHC we're going to see. So first let's look at the PHCs. So the PHCs, E stands for the essential as well as D stands for the desired. Essential and D is for the desired. Now we'll be writing in short. So let's look at medical officers, that is we have done MBBS. So here it is E1 and D1, that is expected, and the essential and the desirable is 1. Next we look at the medical officer in terms of Ayush. Here the desired will be 1. Then comes the MO of the dental, medical officer of dental. So here the desired is 1. Next, moving on. What about staff nurses? The staff nurse will be 2 are essential and desired is 1. Pharmacist is going to be 1, who is essential. Then lab technician is also going to be 1, which is essential. The optometrist or the ophthalmic assistant or the vision technician, so this is going to be 1. So the ophthalmic assistant will be nothing but 1, and here it is 1 is going to be desired. Next we will look at the health worker female. The health worker female or the ANM, this will be 1 in terms of the essential. Then moving on to the health worker health assistant male, health worker male or the health assistant male. Here it is 1 in terms of the essential, and the health assistant female, this will be 1 and it is essential. And next, health educator, the health educator or the counselor. In terms of the desirable, it is going to be 1, and dental assistant will be 1D. Then the cold chain or the vaccine logistic assistant, this is going to be 1D. And looking at the data entry operator, this will be 1E. Dresser is 1E. LDC 1 for the accountant, this is going to be 1E. And the sanitation staff, this will be 1E. Next we'll move on to the UPHCs. So in terms of the UPHC, what do we have? In UPHC, there is a slight increase, that is the MBBS officers is going to be E2, that is a medical officers will be E2, and the MO dental will be 1D. MO dental is going to be 1D. Next we look at the staff nurses. Next is the staff nurse. The staff nurse includes, there is 1E and 1D, And looking at the pharmacist will be 1E. The lab technician will be 1E. And the health worker female, this will be 5. This will be 5E. And looking at the health assistant female or the lady health visitor, this is going to be 1E. The health educator or the counselor, health counselor or the educator, here it is 1D. And dental assistant, let's look at the dental assistant. It is going to be 1E. And the cold chain and vaccine logistic assistant, this is going to be 1E. Then moving on to the public health manager, data entry operator, the dresser as well as the LDC one or the accountant, and the sanitation staff. All these are going to be 1D. 1E is going to be 1E. Then we move on to the polyclinic. So what happens in the polyclinic? In terms of polyclinic, it is there is a medical officer, this is MBBS, here it is 2E. And MO dental will be 1E. The specialist, this is for medicine, obs and gynae, as well as pediatrics, ophthalmology, dermat and the psychiatry. This is all going to be 1. And looking at staff nurse, is going to be 2E. Staff nurse is going to be 2E. Pharmacist is going to be 1. Pharmacist is going to be 1E as well as 1D. And there can also be a desirable, there can also be a storekeeper. Then let's look at lab technician. In lab technician it is 1E. Then looking at the ophthalmometrist or the opthal assistant is going to be 1E. Then the healthcare worker female, is going to be 5E. And the health assistant female, it is 1E. The health educator or the counselor, it will be 1E. Then looking at the dental assistant and the cold chain, the dental assistant as well as the cold chain, logistic assistant, this is nothing but 1D. It is going to be 1D. And then when you look at the physiotherapist, the public health manager, the data entry operator, the dresser as well as the LDC accountant, all this is going to be, except the dresser, so there is no dresser, there is a physiotherapist, public health manager, then the data entry operator and the LDC. So all this is going to be 1E. And the sanitation staff here will be 2. This is 2E. Next, let's look at the 24/7 PHCs. In 24/7 PHCs, the MBBS officers, medical officers, should be 2. So there's 2E D1, and the medical officer Ayush is going to be 1D. Next, the MO dental is going to be 1D. And looking at the staff nurse should be 7. So it is about 7. And the pharmacist is 1E, 1D. Then there comes the lab technician. Lab technician is going to be 2E, 1D. And what about the ophthalmologist? The ophthalmic technician or ophthalmic assistant or the visual technician, this is going to be 1D. Next is the health worker female. In terms of the health worker female, it is 1E, as well as the health worker or the health assistant male. This is also going to be 1E. And the health assistant female or the lady health visitor, this is also going to be 1E. Next, let's look at the health educator. So in terms of the health educator or the counselor and the dental assistant, this is 1D. This is all 1D. And looking at the cold chain and the vaccine logistic assistant, this is going to be the 1E. And the physiotherapist as well as the public health manager, this is going to be 1D. Next, looking at the data entry operator, the dresser, as well as the LDC1 accountant, this is going to be 1E. Then what about the sanitation staff? It is going to be 4E. Next, let's look at the 24/7 UPHC. So what is happening in the 24/7 UPHC? So in 24 UPHC, looking at the medical officer, this will be in case of MBBS. So here it is 2ED1. Next, when we look at the medical officer, this is going to be Ayush. Here there is none. And medical officer in terms of dental, here it will be 1D. Staff nurse is going to be 7E. Pharmacist is going to be 1 each, that is 1E and D. And lab technician is going to be 2E, 1D. Next is we are going to look at the ophthalmologist, the optometrist and ophthalmic assistant, vision technician. This is going to be 1D. And next, moving on to the health worker female or the ANM, this is going to be 5E. Next, in terms of the health assistant female or the lady health visitor, this will be 1E. Then when you look at the health educator or the counselor, then the dental assistant, this will be 1D each. And looking at the cold chain and the vaccine logistic, so this will be 1E. Then the physiotherapist is going to be 1D. Next, we will look at the data operator. So looking at the data operator, then the dresser, then the LDC1, this is the accountant as well as this all will be 1E. Then looking at the sanitation staff, this is going to be 4. So when we look at the final values, the total expected in a PHC, the total expected is going to be 12 and the desired is 8. And in terms of UPHC, it is going to be 16E and a 5D. Then comes the polyclinic. In terms of polyclinic, it will be 22E and 3D. Then 24/7 PHC is going to be 23E and 10D. Then comes the 24/7 UPHC. 20% UPSC will be 27E and 8D.